Our next speaker in line is Dr. Nicole Wenderoth. Dr. Nicole Wenderoth is Professor for Neural Control of Movement in the Department of Health Sciences and Technology at ETH Zurich. Her lab at ETH Zurich works on systems neuroscience with an emphasis on neuromotor control. In Singapore, Prof. Wenderoth leads the Future Health Technology program at the Singapore-ETH Center as its founding director. Dr. Wenderoth is going to talk about sharing data collected via future health technologies.
Thank you very much. Thanks a lot for the organizers too for inviting me. And you see, I will talk a little bit about sharing health data. And I would like to come from a slightly different perspective. That is the perspective of the technology developer, and potentially also from the perspective of the person who is responsible and accountable for putting data sharing into practice. And finally, potentially also a few comments from a European. So you might wonder, so this open research data is a new thing, and now she is coming here with new digital health technologies. Don't we have enough on our plate already? Why should we care about that? And the answer to that is that in our experience, and maybe Minche can say something to that as well, very often the governance and what you are allowed to do with your data is always lagging behind the technology. So you very often have much more opportunities to collect data, to connect data, to analyze data. Then you have the governance in place to do that in a good way. And once you have the governance in place, there is the risk that while you are still putting it in, it's already outdated because, again, technology is racing right now. So what I want to do is to maybe encourage all of us to also, have one eye on what we have to do right now, but have another eye on looking a little bit ahead and see what's coming down the line, so that the governance and the rules we define today, that they still hold a bit longer than just tomorrow. So to give you a little bit of context, so I'm the director of the program that is called Future Health Technologies. What we are doing is we are developing mobile digital health concepts, and we try to prove that they have a value for public health. This is a program that is at the CREATE campus at NUS, and there you have a lot of multidisciplinary and also international programs. So what you see here, so we have leading researchers and clinicians in our case. We are mostly from Singapore and Switzerland. We have a few colleagues from Australia. We are collaborating with different agencies here in Singapore, and we are also collaborating with industry partners. What we are trying to do is we want to define the healthcare of the future. And just to give you an idea how that could look like, even though nobody really knows that, but just to give you a little bit an idea in which direction it could go. So this is 2020 roughly, and what you see there here in Singapore, and I would say everywhere around the world, we are quite hospital-centric. So it's a conventional model. Patients go to the hospital, they see a physician, they are treated. Wonderful. Now, 10 years from now, that might look different. And the reason why it might look different is that we all know there's demographic change. The ratio between patients and healthcare professionals will become less and less advantageous. So we have to look at new ways to deliver healthcare. And we might actually end up in a very different healthcare model where we have still a physician or a healthcare professional, but now our patients are not necessarily in the hospital. They might be somewhere at home. And we might also deliver healthcare at the home of our patients. And this morning you heard already that the pandemic was actually a driver of change in open data. Now it was also a driver for these concepts, because a lot of the patients have realized it's actually not the best model in a pandemic if you have to go to a hospital to get help. So it might be that we outsource some of our healthcare to the home of the patients. We might also have some new preventive measures that are not provided by a healthcare professional or a behavioral coach or a personal trainer, but where we again use some digital technologies to facilitate healthy lifestyles. And last but not least, these are the famous wearables that you heard already about. We might also try to use some of our technology to detect health risks early, to prevent them before they actually happen. Now, all these different models have challenges. And they have challenges because these new healthcare models might also require new ways of dealing with data, and particularly for sharing data between the different stakeholders. So I give you an example of stroke rehabilitation, and don't worry, it's not so related to stroke. But the conventional model is you need some physiotherapy, the patient goes to a physiotherapy center, is treated. And that means our physiotherapists, they might collect some clinical data, they might collect them for research. These data might go into a hospital database. They can be shared with researchers after some de-identification and anonymization techniques. But this is all behind a lock, and the hospital will be responsible for opening this lock. Finally, when the researchers had access to the data, they might actually get something useful out of it. And of course, the idea is it will flow back into the treatment. So there's a cycle here. But I just want to mention that this cycle, going from collecting the data to learning something from it and until implementing it again, so this is years usually. So that's very slow. Now, when we now look at a new model, but might be a bit more based on digital technology. So here our patients might do something at home. They might have a sensing device. They might have a little robot at home that helps them to do training. Some things are still very similar. So also here data are connected. They are not classical clinical data, but they are health-related data. They tell us something about the functional status of the patient, but also compliance, progress, other things. This might now go into a health cloud. And from there, it might still go to a hospital. So until now, not so different. But in addition to this conventional use of data, suddenly we have many more opportunities and many options what we want to do. So the first thing is suddenly we have scalable technology. So we might have many, many patients that are treated at home. These patients might also be distributed between different countries. And I've chosen here Singapore and Switzerland. And the reason is they are both relatively small countries. So when we want to do some health research, we probably have to team up with somebody else simply because our population, even though still impressive at first sight, it's still not at the same scale as you would need it for many health-related research questions. So scaling means many patients potentially also distributed at different places. We might also have different models with whom we want to share our data. So it might not be the conventional hospital, there might be other healthcare professionals, and there might also be researchers. And the key for sharing, it's actually not so easy to define that anymore. It might be a bit more with the patients themselves than with an institution doing that. Now we suddenly also have the opportunity for bidirectional communication. So data is not only going in one direction, it can go back, it can go in loops, it can change in between. So for example, what one can do, so you can have something in the cloud that helps with personalization, with feedback for the patients, and this is just-in-time intervention. So where you're measuring something, you say, now you have to do something. That's a new treatment model, if you like. And these cycles are typically very fast. So this is something that should happen within seconds or minutes. We still have it that researchers might find out something useful from this concept, and that might now be fed back into the health cloud. And also here, giving it back into the health cloud and then back to the patient, since we now have a scalable model where in theory we can collect a lot of data in short time. Also, this cycle that you see here might be much quicker than that what we see here. So from discovery to implementation, that might suddenly be very quick. So that might just be months instead of years. Now, this is all a wonderful model. It has opportunities, but it also has challenges. I thought I just set out a few of them. And when Owen said that he seems a little bit naggy, no, not at all, because I think the trade-offs he pointed out, they are all very, very valid. And if you have to think about how do you deal with them, you really have to titrate it to the right level of these two trade-offs we are talking about. So, and I tried to do that where I show the opportunity on the left side and the challenge on the right side. So first thing I showed you already, so we have now this decentralized big data collection, and we also have bidirectional data exchange. Now, the problem is the data lifecycle is not covered by a single institutional policy anymore. There is not this one hospital that is safeguarding the data. Additionally, we have little institutional control at the edge. That means there where the patient is, so not in the cloud, but at the devices. We do not know so well what's happening there, and we still have to make it secure. And also we have more interfaces between different policies. And that sounds easy, but actually these interfaces between policies from a perspective of governance, that is a problem that is quite difficult to solve. We might have international data sharing with diverse stakeholders. But here also not so easy because we have to harmonize data protection and harm minimization standards across, let's say, legal jurisdictions. So we have to take care of compliance and accountability. And we have to organize it between different countries to ensure that research data can be as open as possible. And you heard this morning, as close as necessary. So that is another problem that's not so easy to address. We might have more innovative and we have more innovation, more translation by accelerating this discovery implementation cycle. But at the same time, we need governance and oversight mechanisms that simply can keep pace with that, what we are trying to do. So I'm not saying I have an answer to that, but I think there are a few pointers I just want to give you from what we have learned from our program where we deal with these questions. So the first thing, and I'm probably saying that 3 times during my presentation, I'm just realizing. So governance and oversight always lag behind the data. So keep that in mind. So how can we mitigate that? So one way to think about that is to start to think about that already very, very early. So are any technology developers here in the room? Hands up, anybody who is developing technology, be it biomedical or medical devices? Nobody. Okay, I can skip this point. So ideally, if you develop these new technologies, think already about the governance, because very often ethics and governance is an afterthought. But I think in our times of technological acceleration, sometimes you want to think that already while you are developing these technologies. And that is actually what we are trying to do. So I'm showing you here people that really know something about ethics and data science. So you'll see Professor Lisa, who's actually a colleague from Owen. She's in our team. We have Professor Vallena from ETH. She's helping us, and they are both in bioethics. So we look at it from the ethical perspective to get the trade-offs right that Owen was pointing out. The second thing is when you deal with data, there's always a legal perspective. So we are collaborating with Hannah Lim here from NTU for the legal aspect of that, what we are doing. And last but not least, it's really important to also talk to your stakeholders. So those people that donate the data to you, those people that want to use it. And as said, if you are in this space, we're doing research in this space and you are developing new stuff, you might want to think about that already very, very early. So ideally, we would also do some innovative governance. So, I mean, until now, we always think about innovation as technology, new methods, new data, whatever, but governance has to change. I think that is already quite clear. And also, ideally, we would empirically test that. And that is another goal of our program. We have a little microcosm of data. We have defined stakeholders. We have defined data. We have a lot of things under control. So we can try different models without causing disaster. And also, ideally, governance and oversight mechanisms are designed such that they can be adapted to new demands. So they're not rigid. They can be changed. So you heard already in Europe, I think open research data is more or less a must-have, and it's implemented by the funders. So for many programs, in order to get funding, you need to have a data management plan, and you also need to have a data sharing plan. So I think this is, in Europe, this is already there. It's not coming, it's there. The thing is, of course, that when we do that with health-related data or with other sensitive data, then it becomes tricky. So there now we have to, we need to develop data sharing concepts that balance, for example, data privacy and general harm minimization when we deal with human data, and at the other hand, the individual knowledge gain. So exactly the trade-off we have heard of before. But one thing I want to stress, if we balance this trade-off, we have to do that for today. But we also have to think about what might be possible in the future. And that is actually one of the things that is challenging, because when you work with digital data and you are in the time and age of artificial intelligence, where you suddenly can decode things from data, you really need to be aware of this technology might change, and something where you cannot de-identify something today, you might be able to de-identify tomorrow. So you really need, again, so one eye has to go ahead and to see what's coming down the line, because you cannot get genie back into the bottle once it's out. So I thought in the end, I might commit a little bit to just share a few thoughts with you. So when we think about these problems, in which categories we think. So we know when we want to share data, we want to have a consent-based model. And for most researchers, that is common sense anyways, because we're all running our experiments, we have an informed consent, and data sharing is typically part of it. When we do that across different countries, one thing is to harmonize the granularity of this informed consent. And one reason I'm saying that, and that's not the European perspective. So in Europe, when you go to a hospital, right, before you are treated as a patient, you are giving them a check to use your data for whatever they want. So there is one checkbox that will say, do you donate all your data to science for making this world a better world? And yes, so very often people will just check it. I realize that is not the case in Singapore. Is that correct? You don't have this blanket consent typically here, but it's still quite narrow. So this is really something when you go internationally, think about that. So even at the consent, there are already differences. The second thing is transparency on which data is used by whom for what. And that might be things like you might want to establish a data use register. And I think this is now the key thing, risk-based access restrictions. And, that sounds very easy and something very nice, when you say, of course, we have to control access according to the risk of the data. But this is actually something very, very hard to do. And you see the bandwidth, it's gone from the 5 safes that you have seen from Minche and you would apply that to very sensitive or high-risk data to make it simple. But you also might have other data, low-risk data, where you really want to lower the barriers to access, and where you can also make it publicly available. Well, making this call is a difficult part. When we think about where do we classify data according to risk, so one thing that is important is the re-identification risk and also associated harm, if you like, and that can be financial, it can be reputational, it can be discrimination, or it can also be stigma. And that is something we should really keep in mind. And the important thing is, since technology goes on and people might extract information from our data tomorrow that we had no idea they would do today, this is something we have to monitor. So as technology goes on, we probably have to reassess, is the risk of a data set still as low as we thought, or did it suddenly change dramatically because another source became available or something else? The actual research purpose is important. That can be more or less risky. And also, again, when you go to different countries, you might want to have a look at the legal framework of users at the other end of the border, so to speak, particularly or even when they access data from abroad. And there are probably many more. I just said a few more things, or a few things that we think these are really the big things we have to think about. Now, another thing that is not so obvious, but maybe we also want to do some impact monitoring. So we want to know if people use our data and they learn something from it, what's coming out of it. And for the good and the bad, if you like. So the good thing to say, look, we have really contributed to the well-being of society, but also to flag that maybe some conclusions have been drawn based on our data, where we think, oh, we really need to be careful with that. So we probably also need to have an eye on the real world impacts that our data has. And in order to be able to do that, some data sharing initiatives, they require people that work with the data to publish that open access. And one can also think about something like an outcome register, where you say, okay, that is in short what we have learned from it, and maybe you want to keep an eye on it. And the last thing is typically with data sharing, but you heard that already 1,000 times, I'll say it once more. So it's implementing the FAIR principle, so to make sure that data is findable, accessible, interoperable, and reusable. And these are just a few thoughts to start discussion. And with that, I would like to thank you very much for your attention.